When's the last time you had a cognitive screening? A test to check your memory, your processing speed, and your overall brain function? If you're like most people, the answer is probably never. Maybe your doctor has asked you a few basic questions at your annual physical, but a true screening? Probably not. Now, let me ask you this. When was the last time you had your hearing test? Because here's what most people don't know, and what's about to change in the way you think about hearing care. Your hearing test should include a cognitive screening every single time. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus, and in my clinic, we don't just test hearing anymore. We screen your brain health at the same time, and today I want to tell you why that has become absolutely essential and why major research from 2024 makes it clear that audiologists need to start doing this as part of their standard practice. Your ears and your brain are far more connected than most people realize, and if we're only checking one without the other, we're missing something critical. Let me show you what I mean. A massive research study came out in 2024, the Lancet Commission on Dementia. These are some of the top researchers in the world, and they spent years asking one question: what can we actually do to help prevent dementia? They identified 14 modifiable risk factors, things that we can actually influence, not genetics, not age, but real actionable health and lifestyle factors. And of all the 14, the biggest one wasn't high blood pressure, it wasn't diabetes, and it wasn't lack of exercise. It was untreated hearing loss in midlife. If this is new information, and if you're learning something valuable, go ahead and hit the like button and subscribe to the channel. We have a lot more to cover on hearing and brain health in the future. The research shows that if we prevented and properly treated hearing loss, we could potentially prevent about 7% of dementia cases worldwide. And when you factor in other things that often come with untreated hearing loss like depression, social isolation, loneliness, that number climbs to nearly 14%. That means 1 in 7 cases of dementia might be preventable by addressing hearing loss and the social connections that come with better hearing. But here's the hopeful part. When people with hearing loss use hearing aids, especially if they have other risk factors, it can significantly reduce their risk of cognitive decline. This is no longer theoretical. This is evidence-based. So why does hearing affect your brain this much? Imagine, your brain is like a smartphone battery. You only have so much power each day. With untreated hearing loss, your brain works overtime just trying to make sense of unclear sound. 50, 60, 70% of your battery gets burned up simply trying to understand speech. That leaves very little for memory, problem solving, or clear thinking. Over time, that strain starts to add up. And then the social piece kicks in. People with untreated hearing loss pull back. They avoid social settings. They stay at home. That isolation is devastating for brain health. So here's the key question. If hearing loss and brain health are this connected, why would we not check both at the same time? That's exactly what leading researchers and professional organizations are now recommending. The American Academy of Audiology, the American Speech-Language Hearing Association, and other experts are all saying the same thing. Cognitive screening should be part of every comprehensive hearing evaluation. It makes perfect clinical sense. As audiologists, we spend far more time with patients than primary care physicians can. We notice how people process information. We see when someone struggles with memory or following instructions. We see the early signs. And hearing loss and cognitive decline can look almost identical. I can't tell you how many times a family has come in believing their loved one has dementia, and it turns out they had untreated hearing loss, or the reverse. Someone thinks they need hearing aids, but there are cognitive changes happening too. If we don't look at both, we're only seeing half of the picture. And early identification matters. The earlier we detect these changes, the more options you have. Lifestyle changes, medical referrals, better hearing management, all of which help support long-term brain health. So why isn't cognitive screening standard already? Traditional tools like the MoCA or the MiniCog take 15 to 20 minutes, require staff time, and are difficult to implement in busy clinics. But the bigger issue is that these tests rely heavily on hearing. You're asking someone with hearing loss to repeat words, follow verbal instruction, and listen for cues. A low score might reflect hearing difficulty, not cognitive function. These tests can also be influenced by education level, language background, and cultural factors. That's far from ideal. So even though we've known about the hearing and brain connection for years, the tools simply weren't practical or reliable in a hearing clinic. That's why the newer technology is so exciting. In our clinic, we use a system called CogniView. It has completely changed how we approach brain health. It's computerized, takes only about 5 minutes, and is fully self-administered. There's no verbal component, no auditory instructions, no scoring errors, and the results are immediate. Most importantly, it's not affected by your education level or whether English is your first language. And because everything is visual and motor response based, it works perfectly for people with hearing loss. CogniView uses adaptive psychophysics, meaning the system actually adjusts the difficulty based on your performance in real time. The test becomes personalized as you take it, which improves accuracy. It's FDA cleared, built from research from the NIH, and measures memory, visual processing, executive function, reaction time, and processing speed. And we can track your results over time to identify changes early. Have you ever had a cognitive screening as part of your hearing care? Let me know in the comments. I'd love to hear your experience. So here's what this means for you. When you come into our clinic for a hearing test, you're going to get a comprehensive look at your hearing and your brain health. If your hearing shows moderate loss, but your cognitive screening looks great, that tells me that we can be proactive with hearing aids and build a plan to protect your long-term brain function. If the cognitive screening shows early changes, that doesn't mean you have dementia. It simply means we should look deeper. I'll send you to a primary care provider or a neurologist for follow-up. And because we caught it early, you'll have options. If we find both hearing loss and cognitive changes, we adjust your care plan. We might use more assistive technology, involve family members more closely, or build communication strategies that fit your specific situation in addition to those referrals to other healthcare providers. My focus isn't just on your ears, it's on your hearing, your brain, your relationship, and your quality of life. The science is clear. Your hearing and your brain are deeply connected. Taking care of one supports the other. The 2024 Lancet Commission identified untreated hearing loss as one of the largest, most modifiable dementia risk factors, and treating hearing loss early helps support long-term brain health. If you'd like to learn more about the hearing-brain connection, you can find additional resources in our online learning center. The link is in the description. And if you want to experience this comprehensive approach to hearing care, including cognitive screening, you can schedule an appointment on our website. The link is also in the description below. As audiologists, we can't just think about fixing hearing anymore. We have to look at cognitive health and the whole person in front of us. For you, this is about being proactive, getting your hearing checked regularly and making sure your audiologist screens your cognitive health at the same time. Because ultimately, this isn't about test scores. It's about staying connected to your loved ones, following conversations, and maintaining independence, and protecting your quality of life. And if we can support your hearing and your brain in that process, that's exactly what this work is all about. So, next time you schedule a hearing test, ask one simple question. Will you be screening my cognitive function at the same time? If the answer is no, you may want to find a hearing care practice that will. We're here to help with your hearing, your brain, and your connection to the people who matter the most.